This is the eHealth Radio Network, your source for health advice on demand. And now your host, Eric Michaels.
Thanks for joining us once again here on the eHealth Radio Network. This is your host, Eric Michaels. eHealth Radio gives you the most current health information, news, and advice featuring some of the leading innovators in healthcare and wellness who are changing healthcare as we know it. For more eHealth Radio reports, we invite you to visit our main radio channel site at eHealthRadioNetwork.com. Today we're speaking with Srulik Dvorsky, the co-founder and CEO of TaylorMed, the leading financial navigation technology company that helps patients and healthcare providers remove financial barriers to care. After serving as the primary caretaker for several family members following a cancer diagnosis, he started TaylorMed with a personal mission to leverage technology to remove the barriers to care. He brings to the company more than a decade of experience in the medical device industry. Mr. Dvorsky, thanks for joining us here today on eHealth Radio.
Thanks, Eric. Happy to be here.
You bet, and really appreciate you taking a moment to be with us here today. So for starters, if you would, what is TaylorMed exactly, and what was the driving force behind the founding of the company?
Yeah, so TaylorMed, as you said, is a healthcare IT company that was founded with a core mission to remove financial barriers to care. As a caregiver and also as someone who has seen many others in tough situation in life when it comes to dealing with their healthcare expenses, I saw that in addition to the hardships and concerns and distress that are coming with a diagnosis of a critical illness or even like a chronic condition, so many Americans are exposed to financial hardships as well when it comes to affording their medication, their treatment, and so forth. And that is something that really troubled us. And I have to say that during that initial phase, looking at the problem, I was also exposed to a term that really went directly into my guts, which was financial toxicity. And that's a term that basically comes to represent the actual side effects related to being diagnosed with a condition, but also having high out-of-pocket expenses to get treated for it. And that's basically what we saw early on. And I think that as someone who worked with patients that were in my family, I couldn't stand this feeling that patients are not getting the care that they need, and they have real barriers to care that are financial. And TaylorMed was founded back in 2017 to try and address that. And throughout the episode of care, the continuum of care, and in healthcare in America as a whole, we are trying to find those barriers and bridge those for patients.
And of course, we're certainly appreciative of what you're doing through TaylorMed already and what you're offering in the space. Now, what unique need is TaylorMed solving for patients and for health systems? Get into that further, if you would.
Yeah, so I think that you are exactly correct that the fact that patients have really high out-of-pocket expenses is first and foremost a problem for patients and their families, but also to other stakeholders in the healthcare ecosystem, providers being one of those. But if I take the angle of the patient first, I think that everything stems from the fact that patients getting treated for critical illnesses, chronic conditions, what have you, are exposed to high out-of-pocket responsibilities. And in addition to the financial hardship, which is, I think, straightforward to understand and everybody knows or have experienced, personally, they need to have, hundreds or if not thousands of dollars to be paid for the care that they need. What we are seeing in addition to the financial hardship is actually the potential of that hardship to impact clinical outcomes. And if you think about that, when someone have a drug that needs to be paid for every month, costing from anywhere between a few $1,000s to hundreds of dollars a month, if not more than that, there is a chance of treatment abandonment or non-adherence, in other words. And that's something that will eventually impact clinical results. If you think about patients that are on high-cost specialty medication for the treatment of their multiple sclerosis, for example, or cancer, those are cases where a patient really sits down and thinks, am I going to get the care that I need and risk leaving my family in debt? Or maybe I will not even start getting that treatment. And I think that that is what is so important and, the unique need for patients. I think that in addition to that, there is a different facet to the problem, because when those patients are coming in from treatment, especially when they have insurance, before they are, getting to the point that the provider needs to charge that out-of-pocket residual from them. The provider will provide the care in a lot of cases and then be exposed to cases where patients that simply put don't have the ability to pay will default on their bills. And that will be something that is called uncompensated care, meaning providers providing care but are unable to collect the revenues that they need in order to keep the door open, to be honest. And I think that that is the other facet of the problem that we are trying to address as well. And the need there is to actually find ways to allow patients to get care, but not only count on the patient's ability to pay to cover that expense for the provider. And I'm happy to say more about how we do that in a second, but that's basically the need from the provider side.
Really appreciate the thorough response to that. Is most helpful. Now, also, what is the importance of price transparency in healthcare for the patient and for a health system? That is certainly a problem and an issue within the healthcare space.
Sure. So I think that price transparency for us is actually part of the broader solution that we are bringing. And basically, just in a couple of sentences, I'll tell you what we do in order to address the very needs that I just touched upon. What we are trying to do is find financial resources that will offset patients' out-of-pocket expenses and have another entity cover that for the patient. And you might ask yourself, who would do that for patients? And the answer is very broad. It starts from, local and nationwide charity funds, but it goes deeper into government subsidies on the federal front or even on the state side, and manufacturers like pharmaceutical companies that will provide copay assistance for patients. Thousands of available programs that patients can qualify for, receive financial assistance, and by that serve as a secure financial resources for the providers, by that basically creating a win-win. And that's what TailorMed is doing. And all of that is done with predictive analytics automatically. Where price transparency comes into play is, first of all, for the patient. I think that you know that there is now a growing trend of consumerization of healthcare, making sure that the patient is not only, finding themselves completely unaware of what's going on from a financial point of view, but actually allowing them to be smart shoppers. What is the cost of the next MRI that I'm going to have? What is the cost for my prescription medication over the next year, and so forth? And having price transparency capabilities allows physicians, providers, or pharmacists to really sit down with the patient and provide them with an outlook of what will be their financial responsibility. And from the provider side, not less important, it allows them to see and project into the future who from their patients will have financial burden, will develop financial toxicity and financial risk, and as a result of that ability to project out-of-pocket expenses, they will be able to proactively find patients in financial need and address those with TailorMed to be able to say, okay, I see that this patient will develop a high out-of-pocket responsibility 3 months from now. Let's enroll them to a copay assistance foundation that will address that financial expense. And by that, again, reduce out-of-pocket, increase access to care, but also increase my revenue collection as a provider.
Really do appreciate all the information shared so far. Certainly is insightful as well. Today we're speaking with Srulik Dvorsky, the co-founder and CEO of TailorMed, the leading financial navigation technology company that helps patients and healthcare providers remove financial barriers to care. And he's joined us here today on eHealth Radio's Health News channel, a part of the eHealth Radio Network. Now, also, how is TailorMed improving the patient experience? Talk to us about that.
I think I would say that the way we are really crafting everything that we do to be patient-centric and improve the experience that the patient is having is around two main factors. One is the ability to be proactive, meaning either through our services or through the provider services using our technology, we are able to proactively find patients in that financial need early on in their medical journey, sometimes even before they actually get their treatment set, and then address those challenges head on very early to reduce financial distress, to reduce general distress, and then to make sure that they are able to concentrate on what matters the most, which is their health. And I think that that's the most important thing that we do instead of them getting a surprise bill or trying to figure out how they're going to pay for something that they have no way of affording. But the second thing that we do, I think, is our holistic approach, Because when you think about a patient or a patient's family going through a complex medical condition, it is not always the patient medical expenses that are only taking the toll on the family, but it can be simple things sometimes as paying for parking in the hospital parking space or traveling to the hospital and having those transportation costs mount to hundreds of dollars a month to get treated. And the holistic approach that we have in our system is to look at the entire financial impact that the episode of care will have on the patient. And in addition to doing what we said before, connecting patients and enrolling them to financial assistance programs, we are also looking at what is called social determinants of health and trying to bridge those factors like assisting with transportation, reducing costs for their utility bills, or even living expenses by connecting them to a variety of different programs that can address that together. And I think together the proactive and holistic approach is what is helping us shape the experience of a patient throughout their episode of care.
Also, Mr. Dvorsky, what is TaylorMed doing to fight inequities in healthcare and level the playing field, if you will? I'd love to hear some input on that.
I think it really goes back to what we just spoke about when it comes to looking holistically at the patient's ability to get care. When you think about patients from different geographic locations or different level of illiteracy or education, you will see that the playing field is, as you said, not leveled. Patients have more opportunities when it comes to financial resources or are better educated to think about even the treatment plan that they need to choose from, will eventually have better access to care, and that is also translated to clinical outcomes. To share something with you, we saw that cancer patients with financial distress are seeing severe rates of mortality, more than an average patient without financial distress. And I think that what we're doing in order to level that playing field and reduce those inequalities is really looking at the gaps in care, the gaps in financial ability to afford treatment, lower that, increase the access, and then making sure that the average patient is not concerned about their ability to get care either through direct medical expenses or even, being able to have better nutrition. And by affording care and affording different social determinants of health that I mentioned before, we are really removing some of those inequalities that are eventually impacting clinical outcomes.
Lastly, Mr. Dvorsky, how has the patient's financial burden impacted providers, particularly at a time when COVID-19 has led to a drop in patient volume? Give us some details and information on that as we conclude today.
I have to say that we've seen that problem exacerbated tremendously. When you think about it, providers, for the most part, are not very profitable organizations. Providing care, there is a lot of expenses and costs for healthcare providers, and those that do okay have really low margins for their financial performance. And when they see patients that are unable to pay, that is definitely impacting that ability from a financial perspective. And when COVID hit, and as you said, a lot of patients didn't come to get their elective surgeries, elective services, or even didn't go to get their cancer diagnosed, those providers took a blow when it came to their revenue collection and financials as a whole. Hundreds of hospitals were closed over the last year, and I think that we've seen the need from providers to find robust financial resources grow even more in the last year. Happy to say that we were able to continue to support our partners and also increase the number of providers that are using TailorMed in order to, in some cases, keep the door open.
I've got to tell you, we really appreciate what you're doing through TailorMed, seeing a need and making it happen and filling the gap for sure. Again, thanks for joining us here today. Before you go in conclusion, any closing thoughts, a final word, a takeaway, or a tip, or anything else you'd like to mention as we do wrap things up?
I think that a patient needs to know that there are many options, and patients do not need to forego treatment and need to have resources provided through their providers to allow them to close those gaps. We are partnering with a lot But for those who don't have that capability of using our system, I think that being well informed about how your care is eventually going to impact your financial status, and knowing that there is something that can be done about it for almost every occasion is something that I will leave our listeners with. And again, happy to help any way we can through our amazing team and technology. Be happy to share more for everybody who's interested on our website.
And the website for more information, again, folks, that is TailorMed.co. Mr. Dvorsky, all the best, and thanks so much for spending a moment with us here today on eHealth Radio and for this fine report.
Thank you so much. It was mine, and thanks, Eric, for hosting me.
It certainly was our pleasure and honor to do so. We've been speaking with Srulik Dvorsky, the co-founder and CEO of TaylorMed, the leading financial navigation technology company that helps patients and healthcare providers remove financial barriers to care. And again, for all the details, visit TailorMed.co. And again, this has been your host, Eric Michaels, and we do thank you for your continued support of the eHealth Radio Network. Join us again soon for another episode that will help further expand your knowledge on those things that are important to your health and wellness. For more eHealth Radio reports, we invite you to visit our main radio channel site at eHealthRadioNetwork.com. And as always, we do thank you for tuning in.
Thanks for tuning in to the eHealth Radio Network. For more information or to subscribe to this podcast, visit eHealthRadioNetwork.com.